It's early morning. You're in your kitchen, holding your favorite mug. The light through the window is soft, the air is quiet, and everything feels normal. No pain, no dizziness, no warning signs, just another peaceful day. But what if, beneath that peace, something silent is growing? High blood pressure is often called the silent killer for a reason. According to the CDC, nearly half of adults in the U.S. live with high blood pressure, and only 1 in 4 has it under control. For people over 60, the risks multiply. The stakes are higher. Why? Because high blood pressure rarely announces itself. There's no headache, no rash, no fever. It creeps in slowly, pressing harder and harder on your arteries with each passing year, until one day it shows up not as a symptom, but as an emergency: a stroke, a heart attack, or a visit to the ER. Think of your circulatory system like the plumbing in your house. You don't know the pressure is too high until a pipe bursts. And when it's your heart, brain, or kidneys, that damage can be life-changing. But here's the hope. High blood pressure is one of the most treatable conditions in medicine. And the fix doesn't have to be overwhelming. In most cases, it's not about massive overhauls or giving up your routines. It's about catching small mistakes, the ones most people don't even realize they're making, and replacing them with better habits that fit your life. In this video, we'll explore 7 of the most common silent mistakes I've seen in over 20 years as a geriatric physician. And I'll walk you through what to do instead clearly, calmly, and in a way that feels realistic. Because blood pressure is more than a number. It's a reflection of how your heart and body are coping with life. The right changes can help you feel stronger, steadier, and more in control. Now, before we dive into the first mistake, let me properly introduce myself and this space we've created for your health. I'm Dr. William Hart. For the past 20 years, I've worked as a geriatric physician, helping older adults manage chronic conditions like high blood pressure, not through fear, but through clarity and small, smart choices. I created this channel, Golden Health, with one mission: to turn trusted science into simple, practical steps that help you stay strong, steady, and independent no matter your age. Here, we skip the medical jargon. We don't promise miracle cures. What we offer is honest guidance that fits into your real life, whether you live in New York, Nebraska, or anywhere in between. So, before we continue, I'd love to know, where are you watching from? Leave a comment with your city or state. You'd be surprised how many others, just like you, are on the same path, quietly building better habits for a healthier future. And if you're here for the first time, welcome. You are not alone. Thousands of older adults are tuning in each week not to be lectured, but to be empowered. Now that you're here, let's talk about why small mistakes matter more after 60 and how your body changes in ways that make even tiny habits more powerful than you might think. So why do these small mistakes matter more after 60? Because your body is different now, not weaker, but more sensitive. And that sensitivity changes the way your blood pressure reacts to everyday choices. Here's what I mean. As we age, our arteries become stiffer. That means blood pushes harder against the vessel walls even when your heart isn't working any harder. Over time, that pressure builds. At the same time, your kidneys slow down. They become less efficient at clearing excess sodium, fluids, and medications. So even a slightly salty meal, or one missed dose of medicine, can affect your blood pressure more than it did 10 or 20 years ago. Your metabolism also slows, meaning your body takes longer to process caffeine, alcohol, or stress hormones. A glass of wine that once helped you relax might now keep your pressure elevated for hours. A stressful morning could affect your numbers all afternoon. Let me tell you about Eleanor, a 72-year-old retired teacher from Kansas. She was careful with her health, walked daily, ate vegetables, took her medications, but her blood pressure kept creeping up. When we looked closely, we found 2 problems. 1, she was getting over 2,000 milligrams of sodium per day from canned soup and bottled dressing, both labeled heart healthy. 2, she often skipped her meds on weekends when she slept in. Individually, these choices didn't seem like a big deal, but combined, they were silently pushing her numbers higher. The truth is, after 60 small decisions carry more weight. A minor habit you barely notice can quietly influence your pressure. And because high blood pressure rarely has symptoms, you don't realize the impact until something goes wrong. But here's the upside: if small habits can raise your pressure, small improvements can lower it. Eleanor made 3 changes: reading food labels, taking her meds on time, and checking her pressure each morning. Within 6 weeks, her blood pressure dropped by 12 points. She had more energy, slept better, and finally felt steady again. So if you've ever felt frustrated doing everything right and still not getting results, don't give up. The answer might not be doing more. It might be doing a few small things differently. Let's take a closer look at those small things, starting with one of the easiest to overlook and easiest to fix. Mistake number 1: not taking your medication properly. One of the most common and dangerous mistakes seniors make is not taking blood pressure medication properly. Many people skip a dose because they feel fine, take pills at random times, or stop altogether when their numbers look good. Others try to make prescriptions last longer by cutting tablets without medical advice. But blood pressure medication only works when taken consistently. These drugs don't provide an immediate feeling of relief. Instead, they quietly reduce strain on the heart, protect blood vessels, and help prevent strokes, heart attacks, and kidney damage. Missing doses or taking them irregularly allows blood pressure to rise and fall unpredictably, silently harming the body over time. The good news is, this mistake is easy to fix. Take your medication at the same time every day, linked to a routine like brushing your teeth or eating breakfast. Use a pill box or set a phone alarm to help you remember. Never stop taking your medication just because your readings look normal. That usually means the medicine is doing its job. If you're experiencing side effects, don't stop on your own. Talk to your doctor about alternatives or dose adjustments. And if cost is an issue, ask your pharmacist about generic versions or discount programs. I once treated an 80-year-old patient named Thomas who skipped his pills on cold mornings, thinking it wouldn't matter. 2 months later, he ended up in the ER with a mild stroke. After that, he built a simple routine: 1 pill every morning at 8 a.m. with warm water, and he hasn't missed a dose since. If you've missed a dose recently, that's okay. But today is the perfect time to start fresh. Every pill you take on time is one small step toward protecting your heart and your future. Mistake number 2: eating too much hidden salt. Another mistake I see often, and one that surprises many people, is consuming too much hidden salt, even when you think you're eating healthy. Most seniors don't use the salt shaker much anymore, and they stay away from chips and processed snacks. But what they may not realize is that over 70% of sodium in a typical diet comes from packaged and prepared foods like canned soups, sauces, breads, frozen meals, and even healthy options like low-fat dressings or veggie burgers. As we age, our kidneys become less efficient at removing sodium, and our blood vessels become more sensitive to it. This means even moderate salt intake can push blood pressure higher quietly, without symptoms. I once worked with Mary, a 69-year-old retired nurse, who avoided adding salt to food and thought she was eating well. But after reviewing her diet, we discovered she was getting nearly 400 milligrams of sodium a day, well above the recommended limit from just a few healthy items in her kitchen. After switching to low-sodium versions, rinsing canned foods, and using lemon juice and herbs for flavor instead of salt, her blood pressure dropped by 10 points in less than a month. The fix doesn't require cutting all flavor from your meals. Just read nutrition labels. Look for products with less than 140 milligrams of sodium per serving, and be mindful of how many servings you eat. Cook at home when you can, and choose fresh or frozen foods without added sauces. Retrain your taste buds gradually, and you may find that you actually enjoy food more when it's not overloaded with salt. Small adjustments in what's already in your pantry can protect your heart more than you think. Mistake number 3: not monitoring blood pressure at home. One of the simplest habits that can make a big difference but is often ignored is checking your blood pressure at home. Many older adults rely only on doctor visits to track their numbers, thinking a few readings a year is enough. But blood pressure changes constantly, affected by stress, meals, sleep, and even the time of day. A reading at the clinic may look perfect, but that one snapshot doesn't show the full picture. In fact, Some people experience white coat syndrome, where their blood pressure spikes at the doctor's office due to nerves, while others have pressure that rises at home without any symptoms at all. I once worked with Mr. Jackson, 76, who always had normal readings at his appointments, but at home he often felt dizzy in the evenings. When we had him measure his pressure twice a day for 2 weeks, we discovered evening spikes that explained everything. With that simple data, we adjusted his medication schedule, and within days, he felt steady again. Home monitoring doesn't require fancy equipment. Use a digital cuff that fits your upper arm. Sit calmly. Keep your arm at heart level, and record your numbers twice a day, morning and evening. Keep a log and bring it to your doctor visits. This habit takes just a few minutes, but it gives your doctor the information needed to keep your treatment safe and effective. If you've never checked your pressure at home, now's the time to start. It's one of the easiest ways to protect your heart and take control of your health. Mistake number 4. Letting stress build up without relief. Another common but silent mistake that affects blood pressure is living with too much stress and not doing anything to manage it. Stress doesn't have to be loud to be harmful. Many older adults carry it quietly: trouble sleeping, feeling tense all the time, a tight chest, or a racing mind. These may not seem serious, but your body reacts. When you're under stress, it releases hormones like adrenaline and cortisol, which tighten your blood vessels and raise your blood pressure even if you feel calm on the outside. Over time, this constant pressure makes it harder for your heart to rest, and it weakens the effect of medications. I remember Grace, 74, who was caring for her husband full-time. She took her meds, ate well, and exercised, but her blood pressure stayed high. What she didn't realize was that chronic stress was working against her. Once we added just 10 minutes of deep breathing and quiet time each day, her pressure began to drop. Managing stress doesn't require anything fancy. Take slow, deep breaths. Go for short walks. Sit by a window. Listen to soft music. Write down a few things you're grateful for. Even 5 minutes a day can make a real difference. You don't need to eliminate stress; that's impossible. But by giving your mind and body space to reset, you give your heart a break too. Start small, stay consistent, and remember, peace is just as important as pills. Mistake number 5. Sitting too much, moving too little. A quiet but serious mistake many seniors make is spending too much time sitting and not moving enough. It's easy to stay in one place watching TV, reading, or resting, especially if your joints ache or you're afraid of falling. But when your body stays still for long periods, circulation slows down, muscles weaken, and your heart works harder than it needs to. Over time, this raises blood pressure and increases your risk of heart problems. Movement doesn't have to mean intense workouts or gym memberships. Just standing up every 30 to 60 minutes, stretching your arms, walking across the room, or doing simple chair exercises can make a difference. I remember Leo, 78, who used to sit most of the day and didn't think it mattered. We started with one small change every hour. He stood up, marched in place for 1 minute, and did a few shoulder rolls. After 3 weeks, his blood pressure dropped by 7 points, and he said he felt more awake and steady. You don't need to do much. You just need to move more often. Your heart needs rhythm, not rest all day. Every small movement is a signal to your body: I'm still active, and I still care. So today, try this: set a timer, and every hour, stand up and move, even if just for 60 seconds. It could be the healthiest minute of your day. Mistake number 6. Drinking too much caffeine or alcohol. Many older adults enjoy a morning coffee or an evening glass of wine, and in moderation. That's fine. But over time, too much caffeine or alcohol can quietly raise your blood pressure, interfere with sleep, and reduce the effectiveness of medications. Caffeine, found in coffee, tea, soda, and chocolate, stimulates your nervous system and narrows blood vessels, leading to temporary spikes in blood pressure. Some people are more sensitive than others, especially after age 60, when the body processes caffeine more slowly. Try this test. Take your blood pressure before and 30 minutes after your usual cup of coffee. If it jumps more than 10 points, your body may be reacting more than you realize. Alcohol has a similar effect. A single drink may help you relax, but regular drinking, even just 1 or 2 glasses each night, can raise blood pressure, interrupt deep sleep, and strain your liver. I once treated Paul, 71, who drank 2 glasses of wine each evening. After cutting back for just 2 weeks, his blood pressure dropped 9 points and his sleep improved. You don't need to cut out everything, but small changes go a long way. Try switching to herbal teas, decaf coffee, or sparkling water with fruit. Drink earlier in the day and skip alcohol a few nights a week. Your heart doesn't need perfection. It just needs balance and less pressure, inside and out. Mistake number 7. Not communicating with your doctor. One of the most overlooked mistakes is not telling your doctor the full story. Many older adults skip appointments, hide mild symptoms, or avoid asking questions because they don't want to seem like a bother. But when it comes to high blood pressure, silence can be dangerous. Your doctor can't help you adjust your treatment if they don't know what's happening between visits. I once met Dorothy, 75, who smiled through her checkups, saying everything was fine, but at home she was dizzy, tired, and skipping meals. Only when she brought in her home blood pressure readings and mentioned a new supplement did we realize the issue: her over-the-counter pills were interacting with her medication. After one simple change, her blood pressure stabilized. The fix: speak up, always. Share even the small things like lightheadedness, sleep changes, or a new vitamin. Bring your blood pressure log to each visit. Ask if your readings look right. If appointments are hard to get to, ask about phone or video calls. And if you're unsure about anything: side effects, dosage, diet, just ask. There are no silly questions when it comes to your heart. The more your doctor knows, the better they can help you stay safe and strong. When you fix these small but powerful habits, the difference adds up. After just a few weeks, many of my patients report lower blood pressure, better sleep, more energy, and fewer dizzy spells. After a few months, they feel more steady, alert, and confident. One patient told me, "For the first time in years, I feel like I'm in control, not my blood pressure." The truth is, high blood pressure doesn't usually need drastic changes. It just needs steady, consistent effort. You don't have to be perfect. You just have to start. Whether it's taking your medication on time, eating less salt, checking your pressure at home, or standing up once an hour, every small habit helps. Together, they ease the strain on your heart, improve circulation, and reduce the risk of heart attack, stroke, and kidney disease. Even a 5-10-point drop in blood pressure can cut your stroke risk by 30%. That's the power of small actions, done daily. So if you've made any of the 7 mistakes we talked about, don't worry. You're not alone, and you can turn things around, starting today. Just pick one change. Make it part of your routine. Then build from there. You'll be amazed how much better your body feels when your habits begin to work with you, not against you. Everything we've discussed, from medication to movement, can help lower blood pressure. But remember, no 2 bodies are the same. What works for one person may need to be adjusted for another, especially if you have other health conditions like diabetes, kidney disease, or heart failure. Always talk to your doctor before making changes to your routine, especially if you're taking multiple medications or have recently experienced weight loss, fatigue, or dizziness. The key is to adapt these habits to your reality, not someone else's. For example, if you use a walker or wheelchair, chair exercises or resistance bands can still keep your body moving safely. If you live alone, set up phone reminders or a simple checklist on the fridge to stay on track. If cooking is hard, use frozen vegetables, pre-cooked proteins, or meal delivery services for seniors. If getting to the clinic is difficult, ask about phone or video visits. I've worked with patients in every kind of situation, and the lesson is always the same. You don't need to do everything. You just need to do what you can, safely and consistently. And if you're a caregiver, your support matters more than you think. Helping a loved one take their meds, check their blood pressure, or simply go for a short walk, these small actions are powerful. Health after 60 is not about keeping up with someone else. It's about finding what works for you and sticking with it. You've just learned 7 small mistakes that can quietly raise your blood pressure, and more importantly, how to fix them. The changes don't require perfection. They don't demand willpower or big money. They just ask for small, consistent action. Take your medication on time. Eat less salt. Move a little more. Check your numbers. Breathe. Talk to your doctor. None of this is complicated, but all of it matters. Your body may not be as fast as it once was, but it's still listening, and it responds quickly to care. You don't have to fix everything today. Just pick one habit. Start there. Build slowly. I've seen it time and time again, people in their 60s, 70s, even 80s, turning their health around with just a few simple changes. So now, I'd love to hear from you. What's one thing you're going to start doing this week? Leave a comment below. Your answer might inspire someone else. And if this video helped you, give it a like, share it with someone you care about, and subscribe to Golden Health. Because aging well isn't about doing more. It's about doing what works with clarity, kindness, and consistency. Your next chapter can be stronger, steadier, and more confident than you think. And it starts with one small step today.